We're not in a great place right now in Ohio as far as infant mortality goes, but I appreciate your enthusiasm and your passion and your vision and foresight as a leader in this area and showing us where we can go and taking us there, quite frankly. Next up to the podium is Tom Horan. Tom is the CEO of Columbus Neighborhood Health Centers. He assumed that position in 2008, and he oversees the strategic direction of the organization, implements policies, and ensures the achievement of the organization's mission and philosophy. He has an extensive background working in leadership roles, including his service as Deputy Commissioner for the City of Columbus Public Health Department for over 20 years. Tom?
Thanks, Julie. It's great being here with folks like Julie, Pat, and Nancy to really talk about what the solutions are, the real solutions to addressing this issue. And we really do know some of the answers and how we can move this forward. So with the work of Senator Jones and Tavares, I think there really is an opportunity to make a difference in this community and make a difference in Ohio by talking about things like the centering program. As the Chief Executive Officer for Columbus Neighborhood Health Center, we call ourselves actually CNHC. We're a federally qualified health center serving more than 30,000 patients here in Columbus and Franklin County, and actually just recently we moved into Pickaway County. Our services are comprehensive. We provide primary care, vision, dental services to men, women, and children. And our patient population is quite diverse, and many are among the community's most vulnerable individuals. Just about half of our patients are uninsured. While we at CNHC will serve all patients regardless of their ability to pay, often our patients who are uninsured tend to delay care. And it is true that individuals with chronic illnesses as well as pregnant women who need obstetrical care tend to delay that care because they may not have the resources, and that's what we're there for. On an annual basis, CNHC provides obstetrical care to over 2,000 women. In 2013, 900 babies were delivered to CNHC patients. Of these, over 92% were of healthy birth weight, a key indicator in preventing infant mortality, and this exceeds the national average by about the national average of 90%. We have also been successful in initiating prenatal care during the first trimester for our patients, and again, in this area, we exceed the national standards in terms of getting women into prenatal care as soon as possible in their pregnancy. The reason for our success is a model of care, which is exactly what Senate Bill 279 promotes. At CNHC, services are provided to pregnant women by a team which includes physicians, nurse practitioners, dietitians, social workers, and nurse midwives. In addition, women participate in pregnancy education programs, which includes information on healthy pregnancy, breastfeeding, infant care, and other topics. We also will be expanding our services to pregnant women through our partnerships with the Mom to Be program, which you just heard Dr. Gabbe talk about. And we're very excited about this, being able to bring this concept of the Moms to Be program and the clinical services program together at our site on the south side. And we hope that's something we're going to be able to grow and expand and really bring the centering model into. As Dr. Gabbe said, it's really an exciting opportunity that we're looking forward to for the future. What we are doing at CNHC is at the heart of the centering pregnancy model. Centering pregnancy programs integrate a variety of services in order to promise a healthy pregnancy and to reduce the risks which lead to poor birth outcomes. The model includes health assessment, education, and support that enables pregnant women to meet together, to learn skills, participate in facilitated discussions, and importantly, to develop a support network for their pregnancy and beyond. And I think it's very important that when we think about the continuum of care, we think about, early on in the pregnancy, but women need that support during the pregnancy, on the other side of the pregnancy, and as they begin to raise their children, through the first year and beyond. It's really a continuum of care that goes well beyond, and this is actually something that builds off of this model. Senate Bill 279 also supports important metrics and outcomes essential to healthy babies, including measuring birth weights and the percentage of women beginning care in their first trimester, pregnant women who stop smoking upon entry to care, and other factors that will inform providers as to the most effective strategies and interventions. I have seen firsthand at CNHC the value of providing comprehensive services to pregnant women that go far beyond obstetrical care. Pregnant women who present at FQHCs face numbers of challenges, vulnerabilities that, left unaddressed, certainly contribute to poor health outcomes. Many of these women are well below the poverty level. They have unstable housing, may have mental health or addiction issues, and lack stable support systems. Addressing some of these factors and providing pregnancy and child care education is at times as critical to improving birth outcomes as checking the fetal heart rates or conducting ultrasounds. We are fortunate at CNHC, as one of the larger FQHCs in Ohio, to be able to provide comprehensive care and address these issues. We have seen the centering pregnancy model in action, and we know that it works by the evidence of healthy babies who are born to our patients. But this is not something that only the larger centers in the urban areas should be able to provide. If we hope to address Ohio's infant mortality rate, the time for action is now. We know this model works, so let's make it work for everyone, for every pregnant woman who presents at an FQHC. On behalf of the women we currently serve and the thousands who will come to us in the future, I support the immediate passage of Senate Bill 279 as part of the mid-biennium review. Thank you.